Hi everyone, my name is Dr. Michael Wald, the Blood Detective, and thanks for joining me for this presentation today entitled Leaky Mouth Syndrome and Disease. And I decided to do this particular topic because no one else talks about it, but it's very, very important. Have you heard of leaky gut syndrome? Well, this is very similar, not to mention that the mouth is, of course, the entryway to the intestinal tract. So whatever happens at any point in the intestinal tract usually affects the whole tract. But there was an article in the Scientific American magazine, I would say more than 10 years ago, more like 15 years ago. I remember passing by the magazine at Grand Central Station and talked about the mouth and how bacteria and other infections in the mouth can lead to everything from arthritis to autoimmune disease to cancer and even diabetes. But since then, I've never heard anyone talk about this. And then I coined the term leaky mouth syndrome. So let's get into this topic, and I want to just first mention that this information is for education. It's not meant as a substitute for sound medical or health advice. And just briefly about me, I'm a doctor of chiropractic with a master's degree and board certification in nutrition. I'm also a sports nutritionist. I have a medical diploma, but not an active license to practice medicine. I also am a life coach and provide acupuncture to my clients. So leaky mouth syndrome is a term coined by me describing inflammation in the oral cavity that compromises the integrity of the mouth's barrier system. So the cells here should have tight junctions, but they get leaky, things can get through them, and then they can travel to different areas of the body, promote inflammation and all kinds of other degenerative conditions and circumstances. So leaky mouth syndrome permits viruses, bacteria, food particles, and toxins to pass into the vasculature and into the digestive tract. So these infiltrations can cause or trigger systemic inflammation, disrupt immune function, and contribute to chronic conditions such as autoimmunity, joint disorders, vascular function, and I mentioned too, autoimmune arthritis, even diabetes, and some cancers. So obviously addressing oral inflammation is ideal. And dentists, as far as I know, would say that you should floss, obviously, and use some sort of mouthwash. There are whole issues with those as well. There's contention within the dental industry that flossing can actually worsen leaky mouth syndrome. They don't use the term leaky mouth syndrome. That again is my term. So I guess the best advice I can give you now in terms of flossing is you do want to floss at least once a day, but you want to be gentle about it. You don't want to be aggressive about it. It'll cause recession of the gums, not to mention leakiness, and then all of these bacteria, fungi, viruses, for example, that can make their way in, and that is a very bad situation. In terms of mouthwash, mouthwash will kill a bunch of bugs in the mouth, but the strongest ones will survive. The same thing with antibiotics. You take an antibiotic, hopefully kills the bug you want to kill. But along the course of doing that, any bugs that survive usually are the most resistant, and then they replicate over time. So the same with mouthwash. Again, that's something I'll probably cover in a future podcast, if enough of you want to hear about the dangers of mouthwash and flossing. So inflammation in the gums, on the tongue, and the oral tissues break down the mucosal barrier. So microbes and particles leak into the bloodstream and digestive tract. Similar to leaky gut, this can cause widespread inflammation because, again, these particles enter from the mouth, they get into the bloodstream, and then they can wreak havoc wherever they are circulated to, and leading to immune dysfunction and worsening of cardiovascular issues and a triggering of any number of autoimmune diseases. So what exactly is leaking into the mouth or through the mouth into the circulation? Again, viruses and bacteria, herpes, strep, they can enter inflamed tissues and enter the bloodstream. Parasites from contaminated food or water. So they don't just go into the digestive tract. And if you have low or no stomach acid, by the way, which most of us over age 60 do not, parasites and other bugs that get through, they will survive. And then they just, what they call extravagate or go to different areas of the body. And then there's undigested food particles, which can trigger inflammatory reactions in the body. And then there are toxins, heavy metals, and chemicals from dental products or environment. And then entry also of these particles occurs through damaged epithelial lining. Then it can spread via capillary-rich oral tissue. And in addition, and in terms of harmful oral habits, first of all, hard brushing of your gums and teeth will cause micro tears and gum recession. And then aggressive flossing, as I mentioned earlier, may push bacteria into the gum line. And then alcohol-based mouthwash will disrupt oral microbiome balance. And then malnutrition or undernutrition, like deficiencies in zinc and vitamin C and vitamin D and protein and collagen, will all weaken the tissues. And then, of course, dehydration will reduce the protective saliva. These are just some of the mechanisms. And in terms of some of the ways we can nutritionally manage the oral cavity to reduce the leaky mouth syndrome tendency is by practicing what's known as oil pulling. So oil pulling with organic cold-pressed coconut or sesame seed oil is quite good because the oil will trap and pull out lots of bacteria and inflammatory mediators. And then there's vitamin C, D3, vitamin K2, zinc, and collagen peptides. They all support repair of leaky oral mucosa. And then the use of probiotics using oral strains like Streptococcus. And then there's L-glutamine and quercetin, which strengthen mucosal integrity as well. And then I mentioned hydration and also alkaline foods, which reduce inflammation. Alkaline foods only means that in a laboratory the foods are alkaline. That it doesn't mean that if you eat the foods, these alkaline foods add alkaline to you. That's a whole other complex conversation, and if you watch or listen to my podcast known as pH Lies, you'll learn much more about pH in the body and the fallacy of being alkaline. And then there's some laboratory tests, what I consider functional or blood detective laboratory tests, which can help assess your susceptibility to leaky mouth syndrome and all the different diseases and problems that it could cause. You can measure your serum salivary IgA, which is an immune molecule. You can do oral microbiome testing by actually checking for the presence of certain bacteria. And then you can do a homocysteine test with a high sensitivity C-reactive protein, which lets you know about your level of inflammation throughout the body. You might use food sensitivity panels to help identify immune triggering proteins. And then there's vitamin D testing, zinc testing, and antioxidant status. All are very important for mucosal barrier function. And then whatever specific test that you need given your health problems will reveal what you need fundamentally. So in other words, if we're just considering oral health and leaky mouth syndrome, you might consider these tests right here. But you may have other health problems or health goals. So you might need varying other tests, which would also be very illuminating in terms of what it is you need overall. And for joining me today for this primer on leaky mouth syndrome, I hope it was useful, and I'll see you at the next presentation. Thank you. Then finally, what I do with patients is once I go through a careful, detailed history, I decide what laboratory testing that I will do, and then I'll provide nutritional supplements at doses that are appropriate for the person, along with the proper foods and other lifestyle measures to mitigate or reduce the leaky mouth syndrome, such as the oil pulling that I discovered, and proper flossing, and the use of the right nutrition, along with hydration, to improve and strengthen the oral mucosa. So thank you so much.